Good afternoon, everyone, and welcome to Meet the Researcher from the Westmead Institute for Medical Research. My name is Ivan Power. I'm a director of the Westmead Institute for Medical Research, or WIMR, as you'll hear it referred to during today's session. And I'm also the chair of the WIMR Foundation. I'd like to begin by acknowledging the traditional custodians of country and their connections to the land on which we're all sitting today. We pay our respects to elders past, present, and extend that respect to all Aboriginal and Torres Strait Islander peoples. Every day here in Sydney at the moment, at around 11 o'clock, we're bombarded by new data and information on the physical toll that COVID is taking on our communities. And with each of us subject to considerable uncertainty as to what this means for our families, for our friends, for our colleagues, for our careers, and for our future. The focus of a lot of this public health effort is very much at the moment on physical health, justifiably so. But we are very fortunate that the physical toll of COVID in Australia, however bad, is somewhat less than many other countries have experienced. But that doesn't mean that the total toll is going to be less, because the toll on our mental health is likely to be considerable. Thankfully, just hearing the words mental health, we hear that a lot more than what we used to, even just a couple of years ago. That's a really wonderful thing. But as we discussed today, we are still very short on understanding, on data, and on funding to understand our brains in the same way that we do many other of our physical systems as human beings. We're going to discuss a range of issues today, looking at how COVID is impacting mental health, looking at the data to unpack broader trends in mental health that even predate COVID, chatting about the work being done at WIMR and why it is so important, as well as some practical tips for you on managing your own mental health and for those that are close to you. We're not aiming to be giving specific or medical advice. We're not aiming to be predicting the future. We can't comment on policing or political matters and how this impacts things. We want to ensure that you, as people in society, have a very solid base of information, access to experts like you'll hear from Anthony today to ask specific questions on issues that might be close to your heart. And most importantly, deliver one or two clear ways of being able to communicate this to those who are close to you. We found that we've also been doing some really interesting sessions like this for some quite large employers who found these sessions really useful. If you do and you'd like to, please get in touch with us afterwards and we can facilitate. We're really fortunate today to be joined by one of Australia's preeminent medical experts on the brain and on mental health. Professor Anthony Harris is a consultant psychiatrist with special interests in early intervention and psychosis. He's the head of the speciality of psychiatry at the Sydney Medical School. His clinical and research interests include psychophysiology, neuroimaging, and the treatment of psychotic and mood disorders. We're so blessed to have Anthony as leading the Brain Dynamics Centre at Westmead Institute for Medical Research. And really importantly, like many of his colleagues, Anthony is not just a research scientist. He remains a practicing psychiatrist, spending time every week consulting with patients in addition to working through issues in the lab. That's the crucial difference between WIMR and many other medical research institutes that we're blessed with being at the centre of one of Australia's largest health precincts. Our specialists are practical, practicing doctors as well as being scientists. For those of you who don't know, WIMR and Westmead more broadly has been a really key component in Australia's battle against COVID, being involved in almost all aspects of the public health response, whether it's testing, tracing, treatments, including the many mental health issues that are actually presenting in emergency wards at Westmead at the moment, and as regards vaccine development. Right now, Westmead is arguably at the epicenter of Australia's response to COVID in the field, and we're very grateful to Anthony and his colleagues for taking their precious time to spend with us today. A reminder to everyone that we'll be leaving plenty of time for questions during this session, which you can log using the chat function on Zoom. So Anthony, perhaps you can start by giving us an overview of the mental health issues that we're currently seeing in Australia at a pretty high level, like looking at some research and some of the statistics.
Yeah, thanks very much, Ivan, for inviting me to this presentation today, because I think mental health is firstly really important to all our health. You can't be healthy without excellent mental health. And at this period of time with COVID affecting so many people, it's even more important. Certainly Westmead, if you look at the papers, really is at the epicenter of COVID just at this moment. And so, Ivan, if you could go on to the first of those slides. So what I'll be doing here is just going over a couple of slides which really paint a picture of where mental health is from the point of view of Australia, and where our research perhaps should be going to before we zoom in on COVID and mental health. So the first thing to acknowledge about mental health is that mental illness is common. So this slide from a recent report about mental health by the Productivity Commission paints the picture really well. So we have about 17% of the Australian population will have experienced a mental illness of some sort over the last 12 months. Now, most of those people will only have had a mild illness, and that's great. But there's this large pool of nearly 6 million people who are teetering on the brink, and what we really want to do is make sure that they don't go into a mild, moderate, or severe illness. Now, those illnesses are more common in regional and remote areas, unfortunately, exactly where the health resources aren't. And they're more common in lower socioeconomic status groups and in Aboriginal and Torres Strait Islander groups. So people who are poorer, who are perhaps on the margins a bit more, are far more likely to have problems with mental illness of one sort or another. But 17%, that's a lot of people. Ivan, next slide, please. So you can see that mental illness is a problem for Australia. Now, why this is, we're not sure, but if you look at mental illness as the proportion of total health loss, a bit of a big concept, and we're just looking at the rich countries as opposed to the world, although mental illness is a major issue for low and medium income countries as well, you can see that Australia, like the United States, mental illness is really up there as an issue in our health system. It's a problem for the population more than in some other countries. Next slide, please, Ivan. And if we were to think about how it's changed over the last, nearly 20 years, we can see overall, thinking about a measure of health related problems called a disability affected life year, a way of adding up all of the problems that are to our health from an area. You can see that coronary heart disease and stroke, we're getting on top of those. So the disability affected life years from coronary heart disease halved, stroke plummeted. Back pain, rheumatoid arthritis, osteoarthritis, those pains of life, they're still there. Cancers, all of those cancers, we are really helping with those things. We're getting on top of those. They are coming under more control and dropping down the ranks. Respiratory problems and dementia. We acknowledge that dementia is an increasing problem in our community. We can see how that's gone up, as has asthma, and type 2 diabetes is stuck there, slightly lower, even though we're becoming a more obese nation. But next, please. We can see how anxiety, depression, and the next slip, and suicide and self-inflicted injuries are either stayed the same or have increased. And this paints a very interesting picture. If we think about where research has been really effective over the past 20 to 40 years, we can see that it's, my colleagues who are the heart specialists, who are the heart researchers, the people who are helping lead the way with cancer treatment, you can see the effectiveness of those interventions. Many of them are preventive, many of them are public health, but also in the treatments, how they are really impacting upon those disability-affected life years. But unfortunately, for various reasons, and we'll go into those, we haven't had the same level of success for the common psychiatric diseases or the less common low prevalence ones like schizophrenia. So they're really high impact diseases, third and fifth in that range of different disorders coming to Australia. Why is mental illness such an issue for our community? There are a number of reasons for this. As I've already said, they're common. So a large proportion of the Australian population will have them over any 12 months. But there are things about these illnesses. They start early in life. This particular graph looks at the prevalence of mental illness by age. And you can see that in the younger age groups from 15 to 30, anxiety disorders, depressive disorders, and substance use disorders are all really high prevalence disorders at those stages. And in fact, they decrease with age. What this means is that people are having problems early in life, and it's really altering potentially the course of their life. These illnesses, it affects the ability of people to learn, it affects their ability to adapt to their surroundings, and they persist, unfortunately, because our treatments are not yet really good enough. Interestingly, whereas there have been some really big changes in interventions for cardiac illnesses or cancers of various sorts, there have really been no major changes in treatment for mental illnesses for the past 20 to 30 years. And this is the crux of the problem for us. Next slide, please, Ivan. And unfortunately, when you think about the most severe end of the spectrum of mental illnesses, and with self-harm or years of potential life lost, suicide is now the largest cause of years of potential life lost in this country. This is extraordinary. So it's not the most common reason for death, but it's the cause of the largest number of potential years life lost, because unfortunately too many people are taking their lives, and too many of those people are in that 15 to 44-year-old age group, where it's the leading cause of death. Most of those people, unfortunately, are young men, and many of them are outside our capital cities. But you can see at the bottom that there's a huge number of suicide attempts. So luckily, most people who attempt do not complete. And those people are coming to care throughout this country, and we need to provide better care. Ivan. Now, this is all expensive. And this is one of the other reasons why it would do this country a great deal of good to think and concentrate on mental illness as an area of really determined research and treatment. So although we can see here that our governments are spending around $10 billion worth of money, and there are significant other related and out-of-pocket expenses adding up to about $15.5 billion a year. When we think about the effects of that on our community, they are much larger. So remember, we're talking about young people who are falling out of role, not getting educated, who can't keep their jobs or are working less effectively in their works, presenteeism or absenteeism. Those add up to at least another $15 billion. And then there's also the fact that if you're unwell, then you're calling upon your family and friends to look after you, and that takes them away. This means the cost of the economy is somewhere between $40 and $70 billion a year. This is an extraordinarily large amount of money. Now, even if we just think about those mental health care and related services from government, so that's about 7 to 7.5% of the budget, the healthcare budget in this country, that $15.5 billion. That's a lot of money. But the burden of disease is 14% to 15%. So mental health is only getting about half of the budget for 14% of the burden. And this inequality has something to do, I suspect, with the outcomes that we're getting. That's a larger argument, but it's an important thing. Ivan.
Yeah, and Anthony, just on that point, it'd be worth you, which I think we'll get to, just unpacking that loss of productivity point, which I think is you know, a lot of the people on this call will be involved in business and will have a sense of this. But
Yeah.
climate like this is actually, you know, really stark.
No, it's an astounding amount of money. Now, these figures are done by the Productivity Commission. They're not a bunch of psychiatrists advocating for more cash in their back pocket. These are very hard-edged economists, and when looking at the issues at hand, they came to some pretty stark findings. So, the first and most obvious thing is that if you're really affected by mental illness, you're not in the workforce. And that is a significant impost. You can see at the top of $12 to $22 billion. I know from my own research in some of this other area about trying to get people back into work if they've got a mental illness using disability employment services, that it's at the moment those services are about half as effective as they are for other physical illnesses. So only about 20% of people with a significant mental illness on a disability support pension get back into work. And that says something about stigma. It also has something to say about the continued effects of mental illness and the way that we're not using the treatments that we've got. Now, of course, not only are people unemployed, but often when they have a job, they don't turn up or they're unwell, and that absenteeism or presenteeism, just not being very effective, really does add up. So people with mental illness tend to take more sick days, and when they work, they're less effective at work. So being able to treat them effectively will get them back into work and get them performing at work. And these are real issues.
Anthony, maybe just moving on from here to the point of funding of research, and how it is that we look at this relative, as you say, to physical health, which, you know, really dominates the you know, public health and MRI budgets.
Yeah. So I mean, I like to think about it as the floor. So the top floor at WIMR, that's where the cancer people are. Okay, and you can see that that if we look at the research funding, and this is from an international snapshot, although the Australian figures are actually quite similar to this. So at the top for research funding, you can see cancer and neoplasms, trying to find out how to treat cancer better. Very important, not taking away. But if you look at the years lived with disability, that column on the left, you can see that it's that is right down at the bottom. It's much higher for years of life lost, but it's not as, if we look at mental health, the years lived with disability is huge compared with the research spending compared with the other people, the other areas of research. Even though suicide is a significant problem, it's not such an issue from the point of years of life lost. Now, so there's this, in the same way as for health services, there's this imbalance between the importance of this to our community and to our general health, and the money that our community is putting into it. Now, $83 million is a lot of money, but it doesn't really reflect the burden of illness. And interestingly, and this is a good thing for Australia, Australia was basically the only place in the world where there was an increase in funding over the period of time in the from about 2014 to 2019 that this research. So that's a good thing. But 97% from government. So whereas other areas of health have got this large community base of philanthropic interest and donations, that's not so for mental illness. And that says something about the stigma that this area of health still bears, that it isn't the target of philanthropic and community support, which cancer and heart disease is.
Anthony, tell us a little bit about the Brain Dynamics Centre. In particular, what I think is so interesting about what you guys are doing is about taking an extremely scientific and technological perspective in terms of using technology and in many cases some incredibly advanced forms of technology to help you understand the very complex computer we all have in our heads, and to try and apply real science as to what you're seeing and how you're seeing it, and the implications that you actually that have from some of those changes in your brain over time. Tell us a bit about what's some of the stuff that's going on out at Westmead under your watch.
Well, I have the real fortune of working with Mayra Shkrogaka and Richard Bryant, two excellent neuroscientists, far better than me. I'm just the psychiatrist who's out the front talking about these things, but they're excellent scientists in looking at how we can understand what's happening in the brain, and also how we can develop better treatments. Brain dynamics is like the rest of the Westmead Institute, is really interested in translating our research and personalising it, trying to understand what we can do for individuals to improve treatment. Now, you just talked about the brain as a computer. If only it was a computer. If only we could sort of figure that out in that particular way, although I'm challenged by my ordinary computer enough. It is. And this is one of the reasons why we don't know that much about, as much as we would like to know about mental illness. It's complex. And there's nothing on earth quite like it. But what we're doing is that we're trying to understand a couple of different areas. We're trying to understand, firstly, how good is. How can we measure good? How can we measure effectiveness? How can we measure good function in our brain? And then we're very interested in people who have a number of different possible disorders. Bipolar disorder, schizophrenia, psychosis, a focus of mine. Richard Bryant leads the traumatic stress group, and we'll come back to his work for COVID, because stress is really big in COVID. And a whole number of neurodevelopmental disorders, such as eating disorders, attention deficit hyperactivity disorder, and the depression group. We do this by bringing together a whole range of different technologies, MRI, magnetic resonance imaging, EEG, electroencephalography, measures of cognition, how we think, our clinical measures, genetics, and stress measures. We try to integrate these so that we've got a much better idea about what is going wrong, where it is, when it is, and what we might be able to do about it. So it is, we won't go into too much with this, but we have a broad range of illnesses, and really some of our recent donations have really been able to enhance our ability to do this research.
And Anthony, we're going to come back to that. In particular, a wonderful donation from the Parker family, for which we're very grateful. Because I wouldn't mind unpacking some of that about how you're bringing, in a sense, joining the dots about measuring what's going on in our brains and what's going on in our bodies relative to what people are experiencing. I think most of the participants in this are going to be fascinated by some of that stuff. Now, as we dive a little bit more, if you don't mind, into kind of what's going on today in our world, maybe tell us a little bit about, what might actually cause mental illness, the way that, you would define it.
Well, this is probably this is a simple way of looking at it, but it's really important because it goes not only to the causes, but to how we need to treat it, how we need to think about our treatments. And mental illness has got biological, psychological, and social determinants. And COVID and the effects of COVID on our community really bring this all together. We can really see how this is working. So the biology, like for any illness, we start off with our genes. Now, many illnesses have got one gene or two genes to do that are really playing a role in those illnesses. Psychiatric illnesses are complex, and this complexity comes all the way back to the basics of the genes. So in an area that I'm interested in, there are 128 genes that are involved in the development of psychosis. So the interactions of all those genes, very complicated, very hard to hit the target there. We're really interested in the physical treatments and what they're doing. So those genes and the way that we're working with the world, they change the structure of our brain, and they change the activity of our brain. And we can measure that and modify that with our treatments. And our treatments might be biological, or they might be psychological. So psychological causes of mental illness are there. So they're from our earliest days the way that we've been brought up by our family, the way we think about our world, our habits of being pessimistic or optimistic. And those are part and parcel of the lead into illness. And they're things that we can try and work at affecting and changing, both from a point of view of the treatments, but also from the point of view of our day-to-day activities, which can help build our resilience. The social determinants of illness are also really important for psychiatry. So those illnesses that we were talking about, they're commoner if you are alone. They're commoner if you're poor. They're commoner if you're marginalised. If you're a recent migrant, a lot of these illnesses cause increased problems. And this is part of the reason why Western Sydney is having some issues with this, because we are an area in which people often from lower socioeconomic groups, and without the family supports and community supports, because a lot of people just recently arrived here. These things all integrate together, and they do across the whole of health. So the biological health affects the psychological, and vice versa. So really interestingly, for heart disease, if you're depressed, your outcome's much worse than if you're optimistic, if you're healthy. So the biology of some of our illnesses affects our psychological state, and all of these come together as social. So it's a very complex mix of these things. But we'll go on to talk about COVID, because I think that we can really bring out some of these issues there for that. Yeah.
Anthony, just on that, it sounds like to the layman, what you're saying is there's a big element of mental illness that is nature.
Yep.
And then nurture is also a big element, but nurture can often be triggered to the nature and vice versa. And what you're then saying about things like COVID and the environments is it may well be that then this is a leverage factor, not only for mental health issues, but then for physical health issues in terms of how those things are then amplified by the state of mind that you're bringing to it. Is that a way to think about it?
Absolutely, Ivan. And so all those arguments about whether it's nature or whether it's nurture that happened a couple of decades ago, we've left those far behind. And this is, of course, one of the reasons why it's been so hard to unpack what's causing mental illness, because of this complexity. And so we're only now beginning to even develop the tools to look at it in recent years. We just didn't have the wherewithal of being able to understand what's happening. But a place like Westmead is a great place to do it, because we're in the middle of a large health network. We have people who we can work with who are experts in all these other complex areas. And we have a community of supporters and people who are coming into Westmead in which we can look at, engage with, discuss, and try and find out how we can best change these things. So it's a great place to be doing research, but it's really complex. I don't have a computer model of the brain. My colleagues can look at hearts in animals, and it's a very accurate model. Cats can be neurotic, but not like us. They're different.
Anthony, maybe moving on to COVID. So COVID, as you just referred to there, social and psychological changes, like where there's change, very often these things are triggers for maybe pre-existing conditions, or maybe people that might be predetermined, or even people that might not be predetermined, but may well just be affected by their environment. We're all just through one of the great social experiments and environmental changes of our time, probably that many of us will experience. It must have an impact whether no matter where you are. And as you say, in places like Western Sydney, a lot of this is amplified. Tell us what you're seeing, whether it's emergency presentations at Westmead, whether it's through the clinical consultations that you're having, or whether it's through the many community services that you actually are responsible for and involved in out there in the community.
Yeah. So just from the point of view of emergency department, emergency department, Westmead's a very busy place at the moment. And one of the things that we noticed last year when COVID first came through was that we had about a 25% increase in people walking through the door for the first couple of months of the COVID crisis. Now, clearly, nobody back then was really getting COVID, but the stress was increasing anxiety and depression and pushing people into care at quite, that's a significant increase. Now, as we got things under control, that dropped back again, but it's beginning to ramp up again at the same time. And now we're dealing with a system in which we're really getting COVID, and that's sort of shutting wards down. That's making care considerably more complicated. Now, most of my practice is with the youth mental health team, the prevention, early intervention and recovery service around the Parramatta area. So I see young people with significant mental illness in the communities around Westmead, Parramatta, Marylands, Guildford, Auburn, up the hills. So these are areas in which it's a big population and a lot of people who've been unwell. So what it's doing for those people is it's really undermining the treatment. So we, in the same way as I've just talked about a mental illness being biopsychosocial in its origins, our treatments are biopsychosocial. But a lot of the treatments are being undermined. We did a lot of group work. You come along to see me or the psychologist or other members of the team, and we would be using psychological treatments. Video, which is fantastic. This is a fantastic platform. And 2 years ago, none of us would have been thinking about it. We would have been in the wonderful hallway of WIMR having a talk, but we'd be talking to a quarter of the number of people who are online at the moment. But it's not the same as face-to-face. And people aren't as engaged with the therapy, and they find it difficult. A lot of young people that I'm looking after don't have the resources to buy good electronic equipment. They don't have the privacy at home to really be able to talk about things, and so they feel constrained at being able to discuss things online or into the telephone or on Zoom. When I was young, and for most young people, it's a time of great social change and interaction and community and feeling. Your friends are so much more important than your parents or anything else. But all of that's been cut short. So one of the commonest things that we do is we get people involved with sport, or we'd bring them into a group. Can't do groups now. All the sporting codes have shut down in this city. Can't go to church. You can't go to scouts or any of those other activities. So all of those outlets, all those ways of sharing the burdens, of being able to talk to somebody, to be able to say what a terrible time I'm having, all been undermined. And so those psychological and social determinants of illness, but ways of coping, have all been undermined by COVID. And so it's a significant burden. And so the anxious, getting more anxious, those fears, they're just curling up at home. And the people who are depressed are feeling that all of those things that they could do, they can't do. It's a problem.
Anthony, on that point, and particularly with young people, I can say as a father of four, the oldest being 16 and the youngest 10, I hear a lot. I've heard a lot over, in recent years in particular, about people talking about resilience. Now we really need it, particularly my son who's just about to enter year 12. What are the tools when I'm thinking about these guys and when I'm thinking about my team that I might be working with as well? If we want to build, firstly, maybe explaining to us what resilience really is, and then how do we go about building this fantastic thing called particularly resilience? Building it when the most that we can connect with people very often is over a function like this.
Yeah, well, resilience really applies to our ability to cope with the stresses and strains that life throws at us. And it's always one of those things that I should have done last year rather than right now. You're quite right there, Ivan. Yeah. So, but it really somebody with good resilience is able to cope with the pressures that face them, and are able to pull in and have a better circle of supports to help them cope with things, even if their particular style is not is not coping very well. So the ways we've got that slide about this. I don't know whether you want to go back to that slide, it might help people to think about things a bit. But just those 5 points that of resilience, which are really useful. So you've got your relationships, and they haven't gone on. The family that you and your kids are really important to that, and the support that you can give to them, and they to you too, I'd have to say. At times, the love and affection that they can give to you is really important. Exercise and physical health is absolutely there. Use that hour. Get out. I often say that the dogs are having good COVID. They're out there being walked all the time. But that is really important, because not only is that exercise good, but that being with pets, being with other creatures is fantastic. Physical health is more than exercise. It's food. So being able to eat as best quality food as you can, stay off the hamburgers, stay off the fast food. So good looking after yourself. And if you do have any physical illnesses, don't avoid going to your medical practitioner. Make sure that they're being looked at. Thinking about your thinking. So this is one of the things that Brain Dynamics and WIMR can really help you with now. We've got an active trial about this, but which we'll give the details of. But thinking about the way that you're going through life, not picking up on all the negativity. I turn Gladys off. I don't look at the 11 o'clock notification every day, because it was getting me down, seeing the number of cases creeping up. So thinking about the way that you're interacting with people, and looking at positive things. If mindfulness is for you, if being able to still your mind using that, or doing meditation, they're also really excellent and protective tools, but it's hard to turn that on now. But think about the negativity. You can turn that around. Having some purpose, so doing things for other people. First off, your kids, your family. That's where this is based off. But then perhaps thinking about your neighbour, thinking about other people in the community. You and I both do work for organisations outside of our life. WIMR for you, not other NGOs in the mental health field for me. It's really important that we're doing something other than just churning over a job to get the dollars. Having that outside purpose is very good for you. And also very important for everybody in the community is avoiding substance abuse. So having that extra couple of glasses of wine is probably not, almost certainly not, going to be helping your mental health. And certainly there's a broad range of substance abuse that really undermines resilience. And so these 5 factors, you can bring them into your life. You can think about your organisation and think about how you might be able to help with that. So I think that those are things that I think about with resilience, and the sorts of things that I try and build up with my patients.
And Anthony, diving into this, we have some people on the line, no doubt, who would be, firmly locked down in some of these LGAs in Sydney. I suspect some of them are sitting there who are alone. Some of them may not have access to their friends within 5K bubbles, and might be feeling pretty lonely. If it was if you were actually giving, some thoughts to some of these people about, how to actually put these things into practice in their day-to-day lives in the middle of something like this, when they don't have access to some of these people, what would you recommend that some of these people do? Because this is a real live issue for many of the people online.
Absolutely. And it's affecting different people at different stages. So know who your friends are and your family. Stay in touch. So a telephone call is great. If the person at the other end can do a Zoom's free, basically, for the first 40 minutes of your time, or FaceTime, staying in contact on a regular basis. And by regular, get into a habit. Structure is really good for your day and for your communication. So I have a brother who's up in the country. I ring him every Sunday night. Do that all the time. Stay in contact with him. Life might have been fairly bland for the last week, but I still always ring him to check in on how he is. having that structure there. So I get up, whether I'm here at home or when I go into the hospital, I get up at the same time. I do things. I do some exercise first thing in the morning, and I try and have a bit of a walk later on the evening if I can. So I have that structure of the day. So I'm not just lounging around in bed thinking, another day, I'm never going to get through this. I do have that. So thinking I'm very lucky. You know, the jobs that I have keep me really cognitively involved and keep me thinking about helping other people. That's one of the great privileges of working as a doctor and being in the research that I am, that I'm always thinking about those other things. But I'm also actually investing that in the way that I think about myself. So, you can always look at life as a glass half empty, no matter what you're doing, to be thinking about, well, okay, we've got to do that. That wasn't so bad despite all. And avoiding those substances. So cannabis, alcohol, speed, ice, they haven't disappeared because of lockdown. They're always there. And the need to cope with that anxiety by an extra couple of cones or an extra couple of glasses of beer or spirits is always there. And that compounds your isolation and worsens your mental health.
Anthony, you've got, but I'd really love to dive in a little bit more into some of these practical bits. Yeah. I do note that someone certainly noted that you have a confused rooster in the background.
I do. He's not confused. He knows exactly what he wants, but that's a different matter. Yeah.
He's certainly reaching out for attention, which is great. Like, it's probably a very happy rooster. Getting more serious though now, we will have some people on the line as well who actually may have verged into, deeper into some areas of mental health issues, particularly some people may be experiencing actually depressive issues. How do you recommend, when you're thinking about some of those people, about how it's often difficult to start these things and to make these steps to look after yourself? And as you've said, looking after it's very important that we all look after each other. But step one in that is actually looking after yourself to make sure you're well equipped to be able to look after other people. Tell us a little bit about how you might think about, handling, issues where people feel they might be having depressive issues, and how it is that you might think about that and handle some of those things.
Well, the first thing is not to try and deal with them alone. So sitting by yourself, feeling worse and worse and worse is a terrible state to be. To feeling more and more anxious, feeling more and more isolated. The important thing is to reach out and to say, I'm having difficulty. Now, hopefully that will get a good response. Unfortunately, sometimes it doesn't get a good response. But reaching out and sharing those difficulties, and then trying to go out and get some help, some professional help. If you're feeling weighed down, it's often very useful just to think your thoughts out aloud, to go through the symptoms that you've got, and to check in to see what sort of treatment or help you can get. These are the sort of signs and symptoms of depression that you might be worried about. You might be seeing in your relative that they're morose, they're sad, that they seem depressed, or they might be irritable. They might be very snappy. They might be much. You just can't get a reasonable word with them before they cut you off. They might be just as interested. They might be withdrawing from things, not wanting to do things, not interested in the music they always used to listen to, not interested in the TV, the series that they were. They're just curling up in their bedroom, flicking through a couple of channels on YouTube. Their appetite changes. They're losing appetite. They're not eating as much. They're continuing missing a couple of meals a day. They're not sleeping, or they're sleeping all through the day. And fidgety, restless, and they're complaining about aches and pains and just not having any energy. So they'll begin to miss that exercise. They just won't bother going out. They haven't got the motivation to get up and do this thing. And with all of this, they begin to think negatively about themselves, badly about themselves, being worthless and really not being able to think things through. And finally, they might begin to think about hurting themselves or harming themselves. Now, along that way, there's lots of places that people can step in to try and give them a bit of help, to try and help them to begin to change that trajectory down which they're going towards depression and a full clinical syndrome. So that's really important to be able to step in and do something.
And Anthony, I understand that at the moment, typical of Westmead, that we're actually dealing with things that we're seeing actually presented into our health. I understand that you've actually launched a trial at the moment as regards dealing with some of this, actually presenting a service for some people who may be experiencing some of this stuff in terms of traumatic stress in that way.
So this is my colleague Richard Bright, who's actually an international expert on traumatic stress, and he has developed a particular online treatment for the trauma involved with COVID-19, and we're trialing it at the moment. And we'd really love people to go online and to help us with this particular trial. We ran it last year, and it successfully helped people with anxiety and depression. We're trying to tweak that to make it better. And so the whole series of treatments that the Traumatic Stress Clinic provides, and I'm sure we can put the URL for this on the chat line for this, or include that. But I'd really ask people to get involved. You get $100 if you complete it. It's not a bad thing from that point of view. But the really important thing is that this will be very useful for changing the way that you're thinking about things. So we're really trying to help change those cognitions, to do that, to change the way you're thinking about thinking. That's part of that resilience that I was talking about earlier. So this is an important part of our trauma work. We're also doing other studies in depression, looking at medication, looking at the changes in brain activity with that. But this is this trauma stress clinic trial is the one that I really would like to emphasise to people today.
Yeah, and I've just shared that with people, the screen there, Anthony, so people can see that and encourage them to go to the URL, which we will share with people afterwards. And I think it's also really important when we're reflecting on this that there is a variety of services that people can access, which we all know these many services that are available, whether it's, as we have up here, whether it is Lifeline, whether it is Beyond Blue. There's a whole range of these services which are really, really important. I think the bit that I would really encourage those listening to this or watching is to think about this, is that whether it's you or whether it's your family or your friends, is you're not alone. Mm-hmm. There's a lot of people, no matter where you are in Sydney, who are really feeling pretty bad at the moment about their circumstances in different ways. And, from my own perspective as someone who has suffered in the past with some of these issues, actually just simply being able to admit and talk to someone about it in some way was an unbelievable help. And what I would note is that as we're moving into an area where there's issues around vaccination, there's issues around, what will life look like and all these other things, what we would note is the most powerful way that very often that people have to deal with this is actually their close circles and of people who they can simply talk to. And so whether you have a close circle that you can talk to, whether actually you don't, and whether it is through some of these services or some of the stuff that Anthony was actually referring to earlier, some of those other services that you may be able to access. There's certainly, early on when I was a younger man, I felt shame about these issues. And what I discovered as I got older was that there is no shame, and it's an incredible help and an incredible liberation to actually be able to talk about it in some way, shape or form. And so there are a lot of these, whether it is Lifeline, whether it's the Kids Helpline or Beyond View or the mental health line, we'd really encourage people to just start a conversation around some of these points, particularly those that feel that that the light at the end of the tunnel is not bright enough for them. It's a really important moment that we do that.
Ivan, I couldn't agree with you more with that. And I'd actually add on that your general practitioner is a very important starting point for getting into the health system. So, but these lines are very useful.
Yeah. And one other point that I think is really worth noting as well is that there will be a lot of people on this call as well who are actually maybe in good shape and handling it really well. And I think very often what we may forget sometimes when we have better circumstances is that we have a lot to contribute to those who may be hurting. And simply calling that person who you thought you might have forgotten about, or that you're thinking about, or just chatting to someone, one of your colleagues, and asking them how they're feeling.
Mm-hmm.
Some of those points are also really important to be doing, to making those small contributions. And I assume, Anthony, that kind of support network that you get, very often it's the people who nudge you from outside your direct circles that may actually have quite a big impact on you as well.
And so that passing comment about how you're going, I've been worried about you, is really important because it helps to break down the isolation, the loneliness that we're talking about. And although I'm a youth psychiatrist, we need to remember the elderly within this, because they're often a very lonely and very frightened group with COVID around in the community. So loneliness and just reaching out and breaking that down is very important. Yep.
Yeah. And like I said, there's a number of questions that we've got in the chat from people who are raising specific issues of concern that they might have. I'd really encourage you to reach out to these lines that we've left up on screen here. And these lines you're dealing with professional people who are going to be able to deal with your circumstances in this way. I'd really encourage those on the line who have concerns for those around them and those that they love, to really reach out themselves and possibly make some of these calls in order to see how some of those issues can be dealt with. Anthony, if I may move on to possibly a bit of a brighter point. Tell us a little bit about some of the work that you're doing now as a result of the gift that the Parker family has actually been able to.
So what we're opening up with that gift is a way of trying to learn a lot more about where things are happening in the brain and when. So I'll just give a bit of background. So some of our research uses what's called magnetic resonance imaging. This is a very accurate way of looking into the brain and being able to image the structure, being able to see all the anatomical details of that, and where things like blood is flowing within the brain. So that gives us a fantastic idea about where things are happening. The other thing that we do, very commonly done for a long time, is to measure people's brain waves, the electrical activity in the brain. And that gives us an idea about the flux of what area is being activated when particular thoughts or things like that are going through. It's always been our wish to be able to integrate, to bring these things together so that we can find out more about where something is happening and the instant of when it is happening. So an MRI scan is pretty static, can't do much about time, and an EEG is very instantaneous, but we aren't great at being able to say where things are happening. The Parker family gift has given us equipment which will be able to bring those things together, so we'll be able to see much more about where something is happening and when the instant about when it is happening. So we could think about how the network, what we call the connectome, underlying brain activity is changing with thoughts or changing with symptoms. So some of the early work that we plan to use this for is to understand how the brain mishears an auditory hallucination in psychosis. We're also going to be using it to try and to see how depression and response to treatment is changed with using this particular equipment. And with this, that interaction, we'll be able to do a number of things. Firstly, just find out more. And finding out more is surprisingly useful in helping us with understanding what is going wrong in the brain of these particular illnesses. But we hope to use it to develop what are called neurofeedback techniques to help people treat their the depression or get a better understanding about things like their hallucinations without use of medications. And people are very keen to avoid using medications if they can, and to use the power of their brain to get more control over the symptoms of what they're having. So that's this. We're really looking forward to being able to use this. COVID has stopped our research at the moment, as well as so many other things. But when that's over, we're very keen to get this up and running.
Anthony, coming back then to some of the questions from attendees, we have someone who I suspect is not alone, living in a very small space at the moment with lots of other people. They're finding it pretty stressful. What are the two things that you'd recommend to someone in that kind of circumstance in order to make sure that they can reduce the level of stress on them?
The two things, I suppose. What I would, now, this depends upon that individual person. So everybody has their own way of coping with these sort of things. But the two things that I'd suggest to them is, one, really make sure that they make the most of that hour which they've got for exercise, of getting out and getting some space and to breathe a bit more easily. And the other thing that I'd really want to suggest that they do is to begin to develop mindfulness or some meditation techniques which can help them bring a quiet space into whatever corner they have of their very small space. Hard to do within this particular setting, but there are lots of there are some apps, there's some excellent YouTube videos as an introduction to this. There's nothing special about the different techniques of mindfulness or meditation. They've been done for literally thousands of years. So you don't have to be in this particular school or that particular book, but to do that and to bring that quietness into their corner will give them some space, no matter how close the rest of the family or the rest of the flatmates are.
Yeah.
So,
and Anthony, I can tell you as someone who's been, through as circumstances I shared earlier, who's been meditating for 20 years, a really good technique I've found is one that, if people Google, called 4-7-8 breathing, which is around, simple things that you can do over the course of a minute that just kind of bring you for that minute.
Yeah.
And what I find is, wrestling with, at the moment, homeschooling 4 kids, I kind of don't always maintain my cool. And it's not about then going away and sitting and meditating for 20 minutes. It's what can I do in the moment to stop myself from losing it. And I just find little techniques like that really, really handy about using the breath, which, thankfully we've all been given to use. Small things like that, as really creating, some time in that moment to allow me to respond and not just to react, as I'd often say.
Absolutely. I think that's very sensible. And as you said, there are lots of techniques. And so some techniques just don't work, just don't make sense. But others that are using more physical things rather than mental things can be really useful. So being aware of the way that anxiety, that tension is building up in your body, and then being able to focus on that and feel it go is actually really important. Yeah.
And Anthony, we could keep chatting for a hell of a long time. This has been a really amazing session. Just letting everyone know that we will be posting on our website, in addition to LinkedIn and I think Facebook and Instagram as well. We'll be posting, whether it's the full version of this, and I think on our YouTube channel as well, we'll also be posting a full version of this talk, and also some snippets that hopefully we'll be able to share. So please, if you can, follow us on the various socials. Once again, if there are people who are interested in terms of actually doing a more specific talk for their business, for their workplace, for their community and their association, we'd be delighted to do that. We really believe that getting out there and letting world-class experts like Anthony talk and answer your questions is just so crucial to making sure that our community comes out of this in even better shape than where we went in. We'd love the support of others. There's a variety of ways that we have to get involved with WIMR, as I'm sharing at the moment. But I think the point, and particularly given some of the questions we've had here, that I think is most important is I just want to leave people one last snap of this screen here, which is these services. These are not just services for people who might be feeling themselves that they're having a challenge. They're also services that others are able to call to say, how might I engage with someone in my circle, in my family, that I know, that I'm able to help them out in that way. Because these moments of actually just reaching out and talking to someone about it, whether it's your own issue or whether it's an issue of those that you love, is absolutely critical for us. This is actually how we get through these circumstances. Anthony, any final words before we finish up?
Look, Ivan, I suppose the important thing for people in our age group with our kids is to give people a sense of time, that this will pass, that we'll be able to get on top of these moments of COVID, and that there is some help that you could get when things are looking really bad. But age gives you a bit more of a perspective about time, and also the knowledge that, yes, there is some help that you can get to get out of these situations. Okay.
Anthony, we're blessed to have had you, and we thank you for all the wonderful work that you do on behalf of our community, particularly at moments like this. Thank you, and thanks to all the people at Westmead who are really working miracles out there as we speak. To all those on the line, I wish you a very happy Friday and a good weekend, and let's hold together. Hopefully we can come out the other side quite quickly. Thank you.
Thanks very much, Ivan.